what I'm going to talk about is how we've changed the approach to biosecurity since we started the secure food supply plans. We started with secure egg supply, working with APHIS and state officials and industries and academic partners. We started in 2007. And for reasons I'll go into, we've changed the approach to biosecurity. First of all, a little background on secure food supply plans. The overall goals of the secure food supply plans are to detect, control, and contain a foreign animal disease as quickly as possible. That's always been a goal. To avoid interruptions in animal and animal product movement to commercial processing from farms with no evidence of infection. So farms trapped in a control area that can prove there's no evidence of infection to help find a way to move product to market. Provide a continuous supply of safe and wholesome food to consumers, and maintain business continuity for producers, transporters, and food processors. And you can find details on these plans on the APHIS website and on our Iowa State CFSPH website. So we now have 6 different secure food supply plans that we're working on. 3 of them for HPAI, secure egg supply, secure turkey, and secure broiler supply. And we were able to practice those plans recently. For foot and mouth disease, the secure milk and secure beef supply plans. And then the secure pork supply plan includes foot and mouth disease, classical swine fever, and African swine fever. So as I'm sure you're probably already aware, when a foreign animal disease is detected, one of the first things that happens is that the state and federal officials will establish a control area that's at least 10 kilometers diameter around the infected premises. And everything in that area then will be quarantined, all susceptible species, and movement by permit and risk assessment only. And those movement controls stay in place until the foreign animal disease is eradicated and the premises is decontaminated. So it's likely to be many weeks or a few months before those movement controls are lifted. So we want to work on how can we move the premises in that area that are not infected. How can we work to safely move their products to market and their animals to processing? So this would be an example of multiple infected premises. This isn't a real example. This is just a notional one. All the dots in those yellow areas would be uninfected premises that eventually need to be able to move their animals and product to market. And these plans are being developed by an industry, state, federal, academic partnership, funded mostly by USDA, but also some of the commodity groups are providing funding. National pork producers have provided quite a bit of funding. 3 academic partners participating in different aspects, Iowa State, University of Minnesota, Kansas State, and UC Davis. And I'm sure some of our other academic partners are here today. We develop the plans, then we circulate them to working group members on various different topics and get feedback, and then revise the plans and test some of those plans and change the plans based on lessons learned. These plans are always susceptible to updating and changing. And there's some common components to these plans. There's voluntary pre-outbreak preparedness that producers can do to be more ready, to be able to move their animals and products in the event that they find themselves in a control area. Biosecurity is key, is essential to the success of these plans. Everyone has to have confidence that the producers have sufficient biosecurity to protect their herds or flocks from becoming infected. Surveillance is extremely important. It's difficult to prove lack of infection. You can't prove that a herd is not infected or an animal is not infected because they can become infected before they test positive or show any clinical signs. So we need surveillance plans to show lack of evidence of infection with high confidence. There are epidemiology questionnaires that have to be filled out in the event of an outbreak. And the plans include some movement permit guidance. And all of these plans are guidance only. The decision makers make the decisions they need to based on the facts of the outbreak. They're not obligated to do exactly what it says in the plan. They're based on risk assessments, and some of those are completed, some are in process. Risk assessments tend to take quite a while. There's quite a lot of work to do. And then training. Training before the outbreak and training after the outbreak. And recently, there's been reduced confidence in biosecurity since we started building these plans. As Dr. Clifford mentioned, many of us believe that the large poultry industry and swine industry had pretty good biosecurity. Recent experience with the swine enteric coronaviruses, PEDV, Delta Corona, Seneca Valley virus, which is an FMD look-alike virus. It causes blisters in the swine industry, and then avian influenza experience in the poultry industry has shaken the confidence in biosecurity. And of course, it's very difficult to have effective biosecurity to prevent foot and mouth disease infection in animals that are not totally confined indoors in the beef and dairy industry. So we've been working on a new approach to biosecurity. Just as examples, this is the porcine epidemic diarrhea virus. The first case was in April of 2013, and this is the number of affected states 1 year later, by March of 2014. It spread through 30 states, essentially all the states with significant numbers of swine. This is Seneca Valley. Don't know if you can see it, but this is a number of Seneca Valley positive cases just from the Iowa State Diagnostic Laboratory in various states. There's 6 or 7 states that have had cases. We had up to 58 in Iowa from July until the present. And then high-path AI. This is the experience in Iowa from April 13th to June 16th, a 2-month period. We lost 31.5 million poultry. About 40% of our layers became infected. The flocks became infected, and the ones that didn't die from AI had to be killed, but most of them died from the virus. And those 31.5 million birds were on 77 sites. There were 71 commercial sites and only 6 backyard sites. When we started developing the secure egg supply plan, we were very concerned that backyard sites with no biosecurity, because the birds are allowed to roam outside, they would become exposed to wild birds, and it would be backyard flocks that got infected. Then there would be a 6-mile diameter or radius around that, and all of the commercial sites would be trapped in a control area. So how could those commercial sites with good biosecurity continue to move their eggs? And we focused on eggs initially, because they have to move. You can only store eggs for about 2 days, and then they run out of capacity. So we anticipated backyard sites getting infected and very few commercial, and it was just the opposite. Only 6 backyard sites in Iowa, but 71 commercial sites. So there was something about the biosecurity of those commercial sites that had a really big vulnerability. So let's step back and think about biosecurity for control of novel diseases, highly contagious new diseases. One of the first things about biosecurity is expensive and inconvenient. There's no way to get around that. Livestock and poultry producers implement the level of biosecurity needed to protect from endemic diseases so they can stay in business. There is herd and flock immunity for most endemic diseases. That means that there's low levels of pathogen shedding because most of the birds or livestock are immune, and it takes a high dose to cause infection in an immune animal. So low levels of virus, high dose to cause infection. However, the routine level of biosecurity is not sufficient, has proven to be not sufficient to protect from newly introduced highly contagious diseases, like the swine enteric coronaviruses, avian influenza, FMD, classical swine fever, African swine fever, where there's no herd or flock immunity. So there's high levels of pathogen shedding, very high levels of the pathogen in the environment. and low levels of resistance. It only takes a very small dose of virus to cause disease. So we need, the biosecurity for endemic diseases isn't going to be good enough for these kind of diseases. And from the AI outbreak, there were also another lesson learned was a consequence of delayed stamping out. Delayed stamping out of infected flocks, because there were so many so fast, allowed the amount of virus in the environment to become very high. And that challenged the biosecurity. That very high level of virus challenged the biosecurity and made it less effective. After the outbreak, the USDA, state, and industry have all agreed that stamping out of HPAI should be accomplished within 24 hours of diagnosis to prevent those very high virus loads. And with poultry housed indoors, fortunately, there are ways to depopulate quickly very large numbers of animals. However, in a large foot and mouth disease outbreak, stamping out in 24 to 48 hours will become impossible because of the very large herd sizes that Dr. Clifford mentioned. We don't have mechanisms to kill 5,000 dairy cows within 24 hours, and if we did, we wouldn't want to do it anyway. So herds will be allowed to recover if we can't kill them, and virus loads will be very high, again, challenging the biosecurity. And when we have a lot of herds concentrated in small regions, there's going to be a very high virus load. It's going to be very difficult to stop. So the biosecurity lessons learned. For the secure egg supply plan, the original biosecurity was based on current best practices. So what Dr. Darrell Trample did, who developed that biosecurity plan, is he got the biosecurity plans from 4 very large egg production facilities. He put all of their steps into one plan, combined them all, and asked 10 poultry veterinarians to rank those as to what are the most important individual steps. And they came up with, I think, 46 steps that were recommended. And in Iowa, all of our large layer facilities, essentially all of them, voluntarily participated, implemented those 46 steps, and were audited every 6 months. More of a paper audit, but to make sure they were still doing those steps, and they were getting training and doing some other things. However, that was based on biosecurity for endemic diseases, and it was very prescriptive, very specific things that should be done. That biosecurity didn't account for the increased biosecurity needed for new highly contagious disease. It didn't account for premises-specific variables. It was the same for everybody. And we now realize these need to be site-specific. And it didn't sufficiently emphasize the need for continuous on-site monitoring of compliance with the biosecurity practices. And biosecurity only works if everyone on the production site understands the importance of biosecurity and follows it all the time. You can't just do it some of the time. So you've got to make sure everybody understands the importance and the reasons for the biosecurity and follows it whether anybody's watching or not. So after the outbreak was contained, the avian influenza outbreak was contained, the USDA worked very, very hard to get ready for the fall migration and be prepared in case the virus came back. So there were new biosecurity recommendations made that emphasized 3 concepts that were new to most poultry biosecurity plans and that should be implemented on those plans. One was a biosecurity officer for each site, a line of separation for each building, and a perimeter buffer area. And I'll go into that a little more. So the principles of the biosecurity plans, number 1 is it's the producer's responsibility to keep their animals from becoming infected. And that's always been true for all of our infectious diseases. A site-specific biosecurity plan is needed and must be adhered to by everyone all the time. A biosecurity officer with expertise in infectious diseases and production animal agriculture and familiar with the facility should develop the plan and be responsible for monitoring to make sure that everyone understands the plan and everyone follows it all of the time. And that could be one officer for a production system who has site managers that are monitoring it every day. For small operations, it may be the owner of the operation who's their own site biosecurity officer. Animals housed indoors, for animals housed indoors, the walls of the building should be the line of separation, separating the animals from all possible sources of infection. That's a defensible line. If you consider the walls of the building the defensible line, you make sure nothing crosses into the building that can introduce infection. For animals housed indoors, we also recommend a perimeter buffer area where human and vehicle traffic near the buildings have taken steps to be decontaminated. Animals with access to outdoors are more difficult to protect from infection, but the line of separation concept can help for animals that are housed outdoors some of the time. And for those premises, you have a line of separation around the area of the premises, around the farm, where the animals are located, and nothing should cross that line that can introduce infection. And that's no doubt difficult. So the perimeter buffer area concept is aimed at reducing virus entering and contaminating the production site near the buildings. This is for animals housed indoors. Recognizing that complete exclusion is not possible outside of the building, but reducing the virus load in the environment will help to reduce infection. So this is an example of a building site. It could be swine or poultry. These buildings happen to be connected by a walkway. The red line around the green buildings is a line of separation. And to get into the buildings, you have to go through a biosecure entry procedure. The blue area around those buildings is a perimeter buffer area. And you want to draw that so that most routine traffic doesn't have to enter the perimeter buffer area. So if you have feed delivery trucks that can go into the gray driveway at the bottom, not cross into the blue area, they don't really need to be decontaminated, C and D, which is very hard to do every day for all of your deliveries in the middle of winter in Iowa. So you can reduce the required cleaning and disinfection of vehicles to what's necessary. People that enter the buildings go into the perimeter buffer area and they don't walk out of the perimeter buffer area where those vehicles are. There's a lot more explanation to it than that. And personnel that go into the buildings have to use a biosecure entry procedure. This is a picture is an example of a Danish entry system. So any equipment that goes into the building has to be decontaminated or from a known clean source. And as people enter the building, they have to cross over a bench. They sit down on the bench. Well, they take off their outer clothes, sit down on the bench, take off their shoes, put their feet over the bench, put on coveralls that are just for that building, put on boots that are just for that building, and go into the building. This is an example for an outdoor site, a very large outdoor site, and the red line around the outside is a line of separation. Don't let anything cross that might bring virus in. Again, very difficult. You might have to move that line during harvesting when you're bringing in silage or other activities, removing manure, and then reestablish the line using biosecurity to reestablish that line. So by the middle of September, the USDA had the enhanced biosecurity plans ready to go. U.S. Poultry and Egg Association put them up on their website. And there's a 12-point checklist. Basically, do you have a biosecurity officer who's responsible on your site? Are your employees trained? Have you established the line of separation in the perimeter buffer area? And then the other things are all things that might introduce virus. And have you taken care of all of those things? And the producers are asked to check that, yes, that's in place, or it's in progress, or it's not in place. And this is voluntary. We developed a lot of training materials to go along with that, and that's on the poultrybiosecurity.org website. Biosecurity Officer Information Manual, information for the biosecurity officer to help them implement the biosecurity and write their site-specific plan. That's in both Spanish and English. All of the training materials for them to use on the site are in both Spanish and English on that website. And we're now taking this same approach with secure milk, secure beef, and secure pork supply plans. The biosecurity officer, the voluntary checklist, and the biosecurity officer information manual, and training materials. So we're working on all of those. Another concept that is being looked at in poultry is a pre-movement isolation period, that probably for about 5 days before you want to move broilers to slaughter or move turkeys or to slaughter, move live animals, enhanced biosecurity for a limited period of time. And the University of Minnesota is working on that concept for the secure poultry supply plans. We may end up looking at that for the other plans also. So with that, that's a very quick overview of the plans and the biosecurity part of those. Later today, there will be 3 more talks listed here on aspects of the secure food supply plans from other individuals from the Center for Food Security and Public Health that you may be interested in hearing. Thank you.